J. Krug and Associates and our partner Amcheck, I'd like to welcome you to our second healthcare reform seminar. It's our goal today to give you the information you need to take it back to your organizations to make you more efficient and also comply with the ever-changing laws. So with that, I'd like to introduce our guest speaker, Larry Grudzien. Larry spoke at our first seminar, and he's an attorney practicing exclusively in the field of employee benefits. Larry's got experience in dealing with qualified plans, health and welfare, fringe benefits, and executive compensation. He has more than 35 years experience in employee benefit law and extensive practice advising on all aspects of employee benefit law, including drafting and reviewing individually designed and prototype retirement plans and ESOPs, performing due diligence on employee benefit issues for merger, acquisition, and outsourcing transaction, and advising on administrative and design issues involving qualified retirement plans, including ESOPs and health and welfare plans. Mr. Grudzien was also an adjunct faculty member of John Marshall Law School's JLLM program in employee benefits in the Valparaiso University School of Law. Mr. Grudzien has a BA degree in history and political science from Indiana University, JD degree from Valparaiso University School of Law, and LLM degree in tax from Boston University School of Law. Larry is also a member of Illinois and Indiana bars. So with that,
thank you.
Larry.
Thank you very much. This is the best of times, this is the worst of times. And only because information on healthcare reform is coming fast and furious. The feds keep on changing the rules, and everybody's frustrated because we don't know what's happening out there. What I'm going to try to attempt today is kind of give, for all employers, both large and small, what you're going to be facing in 2014, 15, and 16. And please, throughout this presentation, if you have any questions, raise your hand. More than glad to answer any questions. We're also going to have a question and answer period at the end. So if you think of something later, or just approach me. So this presentation, I'm going to talk about how the healthcare reform affects all employers. Then I will go into large employers, small employers, fully insured employers, and self-insured employers. It affects all of them in various ways. So just because you're a small employer doesn't mean I don't have to deal anything. There's certain things you have to worry about. So let's first of all talk about all employers. What's going to be facing all employers? First of all, there's fees and taxes. They're going to be facing every employer when you're offering any type of health benefits. Now, we're talking about healthcare reform. Again, we're not talking about dental and vision or any other benefits. We're talking about health insurance or any type of health coverage. First of all, there's the P-Corps fee. It's been around for a couple of years. And this is to fund a patient-centered outcomes research institute, the CORI fees. This only applies to health benefits. It doesn't apply to dental and vision or any other benefits. And it was first effective for plan years beginning after September 30th, 2012, and it will continue to 2019. If you're insured, don't worry about the insurance company. Will gladly pay the fee and pass the cost on to you. The only times that you're going to be faced with this, if you're self-insured, if you have an HRA or if you have a self-insured medical, then basically what you have to do, you have to pay the fee and file a Form 720. And each year, the Form 720 is due by July 31st. So if you have a plan year that ended in 2013, the fee would be due the next year on July 31st. The first year, the fee was $1 a head, and this year went up to $2 a head. So these fees were calculated on an average number of covered lives under a policy, multiplied by $1 per year for plans ending after October 1st, 2012, and before October 1st, 2013. Then for any plans ending after October 1, then it goes up to $2 a head. And they have not announced what the fees are going to be in the future. And again, if you're insured, don't worry about it. The insurance company will pay the fee. If you're self-insured, then you have to pay the fee yourself. Okay? Another fee is coming is the reinsurance payments fees. And the way I like to describe this, this is basically to lure insurance companies into the marketplace, the exchanges. Basically what the government said to the insurance company is, if you come and join us in the marketplace, we're going to create a slush fund for you, and we'll pay you to enter the marketplaces, and everybody else is going to pay for this through the reinsurance fee. This program is funded through reinsurance assessment on all health insurance carriers and self-insured plan sponsors. The collected fee is used to support reinsurance payments to carriers to cover the cost of high-cost individuals on non-grandfathered individual plans. So this is one way the government's going to lure insurance companies into the marketplace. Now, for fully insured plans, self-insured plans are ultimately liable. There's going to be certain self-insured, self-administered plans are going to be exempt, not for 2014, but for 2015 and 16. And HSAs, health FSAs, and certain prescription drug plans are going to be excluded. Now, if you're insured, again, the insurance companies will, again, pay the fee and pass the cost on to you. This fee is fairly large. It's $63 a head the first year, and then in 2015 is going to go up to $44 a head. So the reason why I'm describing this, because when you get your renewal from the insurance company, you're going to see these fees listed on your bill, and you should basically know what they are. So again, what's going to happen is if you're self-insured, what you basically have to do is go to HHS, go to www.pay.gov, register, and you will input all your information. Now the problem is that the actual form that you have to complete in order to register is not online yet. They've announced that it was going to be available. I checked yesterday. It's still not up. And if you're self-insured, you'll have to register by November 15th, 2014 in order to register, put in your information, and then the HHS will then send you a bill. Now, the way the contributing entity is the insurance company. If you're insured, the first installment, HHS will notify the covered entity of the fee amount, and then contributing entities will be notified by December what the amount is, and it'll be due in 30 days. And then the second installment will be due in the fourth quarter of the year. So again, if you're insured, the insurance company will pay the fee. If you're self-insured, again, you have to register, go to the website under www.pay.gov when the form is available, put your information in, and it will generate, again, a notification from HHS. The last fee is the health insurance industry fee. And again, this is, again, the insurance companies will pay this. It poses an annual fee on insurance companies. It's going to collect $8 billion in 2014, $14.3 billion through 2018. And the fee applies to all fully insured plans, including dental and vision plans. And again, self-insured plans are exempt from this. Each insurer will then make a payment by September 30th of each year. And at first, it's going to be between 2 to 2.5% of the premium, and then it's going to go up to 3 to 4%. Again, the insurance companies will pay this fee and then pass the cost on to you. This is one way that the government is passing the cost on the health care reform to individuals and to employers. How is the fee determined? The insurance fee will be determined based on the receptive market share. And what types of coverage does it apply to? The fee applies to most health insurance coverage, including dental and vision plans. But self-insured plans, accident, disability, income, and specified disease plan programs are going to be excluded. All right, so those are the fees. The next change applies to all employers. It's a 90-day waiting period. Now remember, starting in 2014, the maximum waiting period is going to be 90 days. That's the maximum that person can wait starting for plan years beginning in 2014. All right? Now, please remember this 90-day waiting period only applies to medical plans. It doesn't apply to dental, vision, or any other of your benefits. So you can impose a longer waiting period for any other types of your benefits. So let's look at this. So effective for plan years in 2014, there's a 90-day waiting period. Now the final regulations came out on this in February of 2014. And what it basically indicated is, oh, by the way, Mr. Employer, what you could do is, besides a 90-day waiting period, you can also impose a 30-day orientation period before the 90-day period begins. In fact, what they said was that any full-time employee, they have to be eligible by the beginning of the 4th month after their hire date. That's the longest period of time an individual can wait to be eligible under these programs. Now remember, this 90-day period only applies to full-time employees. If you, as an employer, have something called a variable hour or seasonal employees, these individuals can wait as long as 13 months to be covered. So again, this 90-day waiting period only applies to full-time employees. Now, the way the healthcare reform defines full-time employees is anyone who works 30 hours or more is considered to be a full-time employee. All right. So again, if you have full-time employees, the maximum waiting period for them, and this applies to all employers. So let's look at this. In fact, grandfather plans must also comply with these requirements. And again, as I indicated before, the maximum period of time that somebody can wait in order to be eligible to plan, and what the regulations say, they have to be eligible by the beginning of the 4th month after their hire date. So in this example right there, if somebody is hired in January 6th, the maximum period that that person can wait and they have to be eligible by is May 1st of the year. So waiting period is a period of time. Must pass. It's all calendar days. Some unions for part-time employees have a 1,200 hour requirement. I've seen that many times in collective bargain plans. But again, in counting days, it's all calendar days that are counted in order to get to that 90 days. Pre-existing conditions, just make sure that pre-existing conditions no longer apply. There is an exception to this. The exception is that there's a special exception, for example, for plans that you had in the past. There's a 2-year extension if, for example, if the insurance company extended your group health plan. Now, please remember, as part of the pre-existing condition exclusion, you had to give your employees what's called a credible coverage notice when that person terminated. And I'm advising my clients to continue to give that critical coverage notice until the end of the 2014 year, because some employers, because this pre-existing condition exclusion goes away for plan years beginning in 2014, and there's some employers that have a December renewal date. So they can continue to impose a pre-existing condition, all right, until their plan year beginning in December of 2014. So that credible coverage notice is going to be important until the end of 2014. Out-of-pocket limits. Every plan is going to have to comply with the out-of-pocket limits. And for 2014, this out-of-pocket means the combination of deductibles, co-pays, co-insurance cannot exceed certain levels. As this slide indicates, for single coverage, it cannot exceed $63.50, and for single coverage, and $12.7 for family coverage. For 2015, they raised it. It is going to be $6,600 for individual coverage and $13.2 for family coverage. That's for health reform purposes. Please remember that the out-of-pocket limit for HSAs for high deductible plans is different. And for high deductible plans, it's $64.50 and $12.9. This is for health reform purposes. All right? So there's two different limits. They were the same for 2014 and they were different for 2015. Wellness programs. Wellness programs have become very popular. Many employers have smoking cessation programs, other programs to encourage wellness. And under healthcare reform, what they've indicated is that what you can do for wellness programs, in the past, if you had what's called a outcomes-based wellness program, where you basically had to score at various levels in your health risk assessment, in the past, before 2014, the limit was 20% of the single premium. Starting in 2014, this is for all employers, it's been raised to 30%. For most wellness programs, it can be as high as this slide indicates, up to 50% for smoking cessation programs. So if somebody is smoking and they don't quit smoking, what you can do, you can impose a 50% surcharge as an employer under healthcare reform. Now there's various rules you have to meet. There's 5 different rules under the HIPAA regulations. But again, this is something that you can do to encourage wellness. Cafeteria plans and HRAs. Healthcare reform affects those. And basically, the IRS came out with a notice 2013-54 that said, starting in 2014, Mr. Employers, you can no longer reimburse individual premiums on a pre-tax basis, either through a cafeteria plan, a premium-only plan, or through an HRA, a health reimbursement arrangement. What they indicated, that would be a violation of healthcare reform. So no longer can an employer reimburse on a pre-tax basis individual premiums. And many smaller employers did this. We cannot afford group coverage anymore, so what we're going to do, either we're going to give you a payment on a pre-tax basis to pay for that premium, or you, Mr. Employee, can actually pay for that on a pre-tax basis. And what we're going to do, we're going to establish a cafeteria plan to do that. The IRS came out with this notice, 2013-54, that said, you can't do it. And so what I've encouraged, if you as an employer are going to drop your group plan and you want to give your employees money, what you have to do is you have to give it post-tax, and it cannot be tied to getting coverage. In other words, what you have to do is say to the employees, I'm going to give you $5,000 because we're dropping coverage. And you can do whatever you want with it. We encourage you to get coverage, but it's not contingent on getting coverage. And some employers are putting a condition, show me evidence you've got coverage, you can get the money, and the IRS says you can't do that anymore. You can give the employees money, you can give them a bonus, but it cannot be tied to getting coverage. What some employers are doing is establishing what's called a freestanding health reimbursement arrangement, where an employer would say, well, we can't afford group coverage anymore, so what we're going to do, you give us evidence of either expenses or premiums that we reimburse you on a pre-tax basis. For health coverage, that's no longer going to be allowed. And if you're going to reimburse medical expenses, that HRA, that health reimbursement arrangement, must be integrated with a group health plan. Now, you can still have a freestanding HRA for dental and vision, but you cannot have it for health. Now, also health FSAs. If you sponsor a health FSA, if your health FSA is considered to be an exempted benefit, that health FSA is not subject to healthcare reform. Now, what is an exempted benefit under a health FSA? One, you cannot have employer contributions more than $500. And two, it must be offered with a group health plan, or must be available. It doesn't mean the employee has to pick it. If you don't have a group health plan, that health FSA is then subject to healthcare reform and all the requirements of the healthcare reform. Most health FSAs don't have employer contributions, but if you do, if that employer contribution is more than $500, that health FSA then is subject to healthcare reform. And that's what that slide is trying to say. You can allow the employees to carry over up to $500. In October of 2013, can amend your plan, it's optional, and you can allow your employees to carry over up to $500. Okay? Now, you can do it automatically. You can give the employees elections. That money can be carried over as what we call a general purpose for all medical expenses, or it can be a limited purpose, which is dental and vision. And this carryover will not reduce the $2,500 limit that applies to health FSAs. It's an addition. The only problem with the carryover is that it will affect the employee's ability next year to contribute to an HSA, because if you're participating under a health FSA, in the same year you have a health FSA, you cannot really contribute to an HSA, because that carryover amount, that $500 you can carry over, has to be available for the entire next plan year. So if an employee does carry over, they sign up for a high deductible plan, basically and they carried over $50, too bad, you cannot contribute to an HSA unless it was carried over as a limited purpose. So some employers have amended their health FSAs to put that in this carried over provision. Now, as this slide indicates, there's some unanswered questions. And some of the unanswered questions is, as an employer, if that employer carried over $500 and they terminated, do I have to charge that employee a COBRA premium net amount? And so far, the IRS has not addressed that issue. We don't know. So you can take either stance. You can say, we're going to charge a COBRA premium, or we're not going to charge a COBRA premium. And there's arguments on both sides. And if you want to do this for 2015, you must amend your cafeteria plan by the end of your plan year to do it. So you have to put it in, and if you currently have a grace period, that has to come out. So you can either do a grace period or a carryover, but you can't do both. But again, this allows employees to carry over that $500 and use it for the entire next plan year. Repeal of Defense of Marriage Act. This is something that's a raging battle. It's been raging over the past 10 years. And what's important here is employers are not required to recognize same-sex partners. If you look at any of the IRS guidance, it says that the employers may do this and may do that. And so one thing I just want to say, as an employer, if you object to same-sex marriage, the federal law does not require you to amend your cafeteria plan to provide for it. You can if you want, but you don't have to. And that's something. Now in Illinois, because we do recognize same-sex marriage, the insurance contracts do recognize same-sex spouses as spouses under Illinois law. But if you have, again, facilities in other states or contracts in other states that don't recognize same-sex marriage, you are not required to recognize same-sex marriage, especially under cafeteria plans. But I just warn you, as time goes on, almost in every state of the union, groups are, again, challenging this because it may violate other federal laws, the Equal Protection Act, clause of the Constitution. So, again, there are many states that don't recognize same-sex marriage. Illinois is not one of them. But again, under federal law, under cafeteria plans, you don't have to recognize same-sex marriage. Now, if you do recognize same-sex marriage and you require proof that they got married, we want to see a marriage license. What the IRS has said is if you're going to require it for same-sex partners, you have to do it for all married couples. So under cafeteria plans, you may allow employees who are married as of June 26, 2013 to change their elections. Change can be made at any time during the cafeteria plan year. It includes June 26, 2013. That's the date of the Windsor decision. Or you may wait until 2014 or later to put those provisions in. So if an employer does decide to offer same-sex coverage, make any necessary plan amendments, confirm with the third-party administrator and providers are updating the policies and procedures and notices. Make sure the insurance policies are consistent with your decisions. Determine how the same-sex spouses will be identified, and ensure the payroll systems are updated. Because if you have contracts in other states like Wisconsin or Michigan or Indiana that don't recognize same-sex partners, their contracts may not recognize those spouses as spouses. Now, let's look at the changes for large employers. Now, what happened was, the law indicates a large employer is any employer that is 50 or more what we call full-time equivalent employees. But the IRS has indicated, they came out with regulations, they changed the definition to 100. And they came out with special transitional rules for employers between 50 to 99 employees. And what they said that for employers between 50 to 99 employees, if you jump through a few hoops, which I will discuss in a few minutes, you have until your renewal date in 2016 to comply. What those regulations in February of 2014 did, they created many, many complicated transitional rules you have to jump through some hoops for. And if, as an employer, between 50 to 99, if you don't meet all the hoops, then you have to comply as of January of 2015, despite what you saw in the paper. So there's a myriad of transitional rules you have to be rather concerned about. So beginning in 2015, certain large employers will have to offer coverage. And again, there are certain rules, whether it's January 1st of 2015 or your renewal date in 2015, it's again dependent on certain transitional rules. Now, under the employer mandate, what you're required to do is offer only full-time employees coverage. That's affordable minimum coverage, which is 60%. And that's way below what most employers have been offering in the past if you're offering coverage. It's rather cheap coverage. All right? Now, under the employer mandate, you have to offer coverage to only full-time employees, and full-time employees are defined as anyone who works 30 hours or more. You have to offer coverage to the dependent children, but you don't have to pay for it. The employee will have to pay for it. And under the employer mandate, you don't have to offer coverage to the employee's spouse. Now, the affordability rule, 9.5%, only applies to single coverage. It doesn't apply to dependent coverage. The employee will have to pay for it. There are two penalties. There's a $2,000 penalty, a $3,000 penalty. And the regulations came out with a special rule for 2015 that said that in order to avoid the $2,000 penalty, you have to offer coverage, and this is important, offer coverage to at least 70% of your full-time employees. In 2016, it goes up to 95%. All right? They keep on changing the rules. It's great for me, but it's horrible for you. And that's what confuses many employees, because these transitional rules are pretty complicated. There's a test later. This is one of the transitional rules. And let me explain it to you. Here's what it says. The employer mandate is effective as of January 1st, 2015. But the IRS has provided 3 transitional rules for non-calendar year plans. Now, here's what basically in layman's language it says. It says, okay, what we're going to do, the February 9th date was the date of the regulations. And they said if you're an employer 100 or more, and you have a December 1st renewal date, you can use that December 1st renewal date, and you will not have to comply until December 1st, 2015, but you have to jump through some hoops. First of all, as of that December 1st date, you have to offer affordable coverage. And then, you pick any date within 12 months of February 9th, 2014, and you have to meet one of these two rules. Did you offer coverage to one-third of all your employees, or cover at least 25% of your all employees? So let me repeat that. The first test is, we're looking at all employees, and you had to either offer coverage to at least one-third of all employees, or cover at least one-quarter of all employees. And that's both full-time and part-time. Or did you offer coverage to one-half of your full-time employees, or cover at least one-third of your full-time employees? If you meet one of those two rules, then you have until your renewal date in order to comply with the rules. So if your renewal date is April, it's April, it's May, it's May. If for many businesses in the past that I've talked to, certain industries, they didn't cover a lot of people. And if you can't jump through those hoops, as is described in the slide, then you have to basically comply as of January 1st, 2015. So the last two safe harbors would be available for employers who offered affordable coverage at minimum value by the first day of the plan year beginning in 2014. And again, if you offered coverage to most of your employees, then you have until your renewal date in 2015 to comply. If you haven't offered a lot of your employees any coverage, then you have to comply as of January 2015. Now, first of all, what is a large employer? A large employer is determined 100 or more, and the basic question I get is, well, I own a bunch of businesses. Do I have to combine them? And the answer is yes. The control group rules, as you see there from the Internal Revenue Code, applies. And basically what that says in layman's language is if 5 or fewer individuals own at least 80% of each entity, that's considered to be a control group. And if you are a control group, then you are considered to be one employer. And all employers are added together for that purpose. Now, here's what you do. The determination of whether you're a large employer is done in calendar year 2014. What you do is you total up the number of your full-time employees for each month. And for this purpose, a full-time employee is defined as anyone who works 120 hours or more. And you see, Larry, I thought you said 130 hours. For this purpose, they use 120. I don't know why. So for each month, anyone who works 120 hours or more are considered to be one full-time employee. And then if you have part-timers, you total up their hours for each month and divide it by 120, and that gives you what's called full-time equivalent employees. You add the two figures together for each month, you total them up for each month, for the year, divide by 12, and if that figure is 100 or more, then you are a large employer, and you are subject to the mandate in 2015. They've created a special exception for 2015, another transitional rule that says that, Mr. Employer, instead of using a calendar year, you can use any consecutive 6-month period. And I've used that rule for many businesses to get out of the mandate. Because if you have a seasonal businesses and there's 3-4 months out of the year where you don't have that many employees, bingo, you're home free. There's another transitional rule, came out in February of 2014, for employers with less than 100 employees. If you have between 50 to 99, then you can wait to comply with the employer mandate until 2016, but you have to jump through some hoops. One, you have a limited workforce, which means that you have between 50 to 99 employees during 2014. Two, you must maintain your workforce And don't get rid of people just to get under that number. You have to have a business reason. 3, you have to maintain any previously offered health insurance. So if you got rid of your coverage, guess what? It blows the exemption and you have to comply in 2015. So you have to maintain your coverage. And 4, you have to, again, certify to the IRS that you comply with your transitional rule. Now, there's also a special rule that's, and this is in the law, not a transitional rule. And I've used this a couple times. Let me explain how this rule works that's described in this slide right here. Suppose you own 4 Dairy Queens, and during the year, you have 40 employees between the various stores that you have. But during the summer, you employ hundreds of people, hundreds. And if you did the calculation, those part-time employees would make you a large employer. And what this special rule says, if you have any seasonal workers that work 120 days or less, they're ignored for the large employer calculation. So for example, if you're a camp and you have people that work for you during June, July, and August, then those people are ignored, and you are no longer a large employer. This is something that's been in the law, and is not a transitional rule. Now, penalty taxes. Basically, there are 2 penalty taxes under the employer mandate. If you don't offer coverage, then the penalty is $2,000 per employee. And some employers are thinking about that. They're looking at the numbers and saying, you know, it's cheaper for me not to offer coverage to offer coverage. And the counter to that I do is that studies have shown that many, especially in businesses that have a lot of lower paid people, most of the employees that are going to be working with you that are lower paid are not going to accept the coverage. They're going to waive it. And we're estimating that in those situations, anywhere, the acceptance rates of those employees are anywhere between 20 to 30% are going to accept coverage. The rest are going to waive it. So for 2015, if you're subject to the employer mandate, the most important form in 2015 is the waiver form, showing the IRS that you offered coverage. It can be very simple. Have each employee that you offer coverage to, they say, I'm sorry, I can't afford it, I'm going to waive it. I'll pay the penalty. Sign this. And again, if you don't have an annual enrollment, have an annual enrollment for 2015 because you have to have evidence that you offered them coverage. The second penalty is if you offer coverage, and if the coverage is either not affordable or not minimum coverage, then the penalty is $3,000, but only for those individuals who go on the exchange and get a creditor subsidy. So if you're a company of 100 people, coverage is not affordable, only 3 people go on the exchange, the penalty is only $9,000. Under the law says that you only have to offer coverage to those employees that are considered to be full-time. And as this slide indicates, a full-time person is anyone who works 130 hours or more per month. If you have employees that work less than 30 hours a week, you have no obligation to offer them coverage. You can if you want, but you have no obligation to do so. Only those that are considered full-time. Now, many businesses have an individual called a variable hour or seasonal employee. These are people that from week to week, month to month, their hours will vary. Sometimes they work 20 hours, sometimes they work 30 hours. For those individuals, it's going to be a little tougher to determine whether they're full-time. And what the IRS has done, they've created some interesting, complicated safe harbors that as an employer you can use to determine whether those employees are full-time. Now remember, if you're a large employer and you have to comply as of January 2015, by January 2015 you had to determine who's full-time and offer them coverage not to be penalized. So this is an important determination, and various industries like hotels, restaurants, nursing homes, temp agencies, various other businesses have many variable hour employees, and they have to determine whether those individuals are full-time. Now, who is considered an employee? An employee is what's called the common law standard, and the common law standard says, do you actually control when they work and how they work? And in some situations, some temporary employees from agencies, even though they're working for an agency, could be considered the employee of an employer, because the employer, in essence, controls when they work and how they work. I tell people that if you have temporary employees, just to be safe, I would encourage you to only have temporary employees with you for a maximum of 6 months. Any longer than that, then it becomes dicey. How are hours counted? Well, and again, you have to count all hours they get paid for. Vacation, holidays, any hours they get paid for is considered to be an hour of work. So again, any hours they get paid for. For non-hourly employees, you actually have to start counting hours, or you could do equivalency. If you, days equivalent means a credited employee working at least 1 hour. If they work 1 hour in a day, they get 8 hours. If they work a week, they're deemed to work 40 hours. That's overly generous. Most employers shy away from that because most employees, if they show up at all, are going to be considered to be full-time. Now, there are 3 safe harbors that you can determine whether someone is full-time. One applies on a monthly basis, and the others apply on what's called a look-back basis. And what you can do, you can apply to 3 to 12-month ongoing basis to determine whether any of your variable hour employees are full-time. Under the monthly method, employees will be identified as full-time employees of the initial eligibility using their hours of service for each month and not based on averaging over any prior look-back period. And these employees must be offered coverage at the beginning of the month after 3 full months of employment. So if they work 3 full months of employment of 130 hours, then you have to offer them coverage. I would advise against that. The other safe harbors are called a look-back period, and you pick any 3 to 12-month period to determine whether that employee is full-time. So if you pick a 12-month period, a 12-month measurement period, that employee would have to work 1,560 hours, 130 hours times 12, to be full-time. Now, what that means is if you have variable hour employees, they could wait as long as 13 months to get coverage. So if you designate at the time of hire, I would put your employees in 3 buckets: full-time, part-time, and variable hour. Full-time, you have to offer them coverage after 4 months. Part-time, you never have to offer them coverage. And thirdly, variable hour, you have to measure them. In order to be full-time, they have to wait at least 13 months. A 12-month measurement period and then a 1-month administrative period. Now, this measurement period, employers select you can pick any 3 to 12-month period for determining whether an employee has averaged at least 30 hours. And we look at the total at the end. We look at the total. So if you pick a 6-month period, that's 130 hours times 6. And they would have to work those hours in order to be full-time. The stability period is a period of time that you have to offer them coverage. You measure your variable hour employees, and 3 or 4 do work full-time, and you offer them coverage. The stability period is the coverage of time, is the period that you'll have to offer them coverage. And what this slide is trying to say, if you use a 12-month measurement period, then the stability period must be at least 12 months. Now, employees that fail the minimum hours requirement, again, are not considered to be full-time, and you don't have to offer them coverage. So basically what you have to do, you have to count hours for those employees that you designate as a variable hour employees. So the stability period can be shorter in duration, the number of months, than the associated look-back period. If the employee meets the minimum hours threshold during the look-back period, then the ensuing stability period for coverage must be at least 6 months. And if the employee does not meet the minimum hours threshold, the stability period can be longer than the look-back period. Now, in between the measurement period and the stability period is an optional administrative period. That period cannot exceed 90 days, and this is where you sign them up for coverage. Now, the periods must be uniform, except between certain employee groups. You can vary it between collective bargaining, non-collective bargaining, salary versus hourly, and employees in various states. Now, there's one look-back period we call the standard look-back period for ongoing employees. You, as an employer, pick that period. So it can be any 3 to 12-month period. That's when you measure employees. Again, if you pick a 12-month measurement period, you do it every year. And again, you can have a optional administrative period. Here's an example. You can have a standard look-back period from 10/15/2013 to 10/14/2014. And let's assume that this employer had to comply as of 1/1/2015. The administrative period is from 10/15/2014 to 12/31/2014. And the standard stability period is from 1/1/2015 to 12/31/2015. Now, one thing that's very interesting what the government said is the fact that if one of your variable hour employees, if they decided to take coverage, you have to continue to offer them coverage during that standard period, even if they work part-time. You still have to offer them coverage. The last safe harbor is for new employees. Every new employee gets their own measurement period, and this is called the initial look-back measurement period as opposed to the standard period. Now, when somebody is hired full-time, you have to make a determination whether that employee is considered to be full-time, part-time, or variable hour. There's several limitations here. The initial look-back period and administrative period cannot exceed beyond 13 months plus a fraction of a month. And the new initial stability periods can't be shorter than the standard stability period. So if you have a 12-month standard stability period for ongoing employees, it must be 12 months for new employees. We have an employee, Jim, whose hire date is 5/10/2014. Jim's initial measurement period is from 5/10/2014 to 4/9/2015. This employer has decided to do they have a calendar year plan. They have to comply as of 1/1/2015. They decided to do 11-month initial measurement period followed by a single administrative period. And they do a 12-month stability period. So Jim, it goes from 5/10/2014 to 4/9/2015. The administrative period runs from 4/10/15 to 6/30/2015. Jim gets his own initial stability period that runs from 7/1/2015 to 6/30/2016. Now, here where it gets tricky. Once Jim finishes his initial stability period, the employer looks back, throws Jim into the standard measurement period that runs from 10/15/2014 to 10/14/2015 to see if Jim is full-time. If Jim is full-time, then he gets coverage from 7/1/2016 to 12/31/2016. So every new employee gets their own initial measurement period, and then they're thrown into the employer's standard measurement period. This is done for every employee that you consider to be variable hour, and you have to do this because it's important. And the reason why it's important is that, remember, to avoid the $2,000 penalty, you have to offer coverage to at least 70% of all your full-time employees. In 2015, it goes up to 95% in 2016. So if you have a lot of variable hour and you miss a number of them in 2016 and you offer coverage, and let's say you offer coverage to 93% of your full-time employees, too bad, you're subject to the $2,000 penalty. Oops. In 2016, in order to avoid the penalty, you have to offer coverage to 95% of your full-time employees. If you don't do this right, and you miss a number of them, and you cover 93%, too bad. All right, her question is, suppose you offer it to 100% and only 60% take it, you're off the hook. What's important is the offer. And the most important form in 2015, 16, 17, 18 is the waiver. Evidence that you offered coverage to that employee. And again, we're estimating in certain industries, especially in those industries that have a lot of lower paid people that work full time, that are variable hours, the acceptance rate is going to be anywhere between 20 to 30%. A lot of people cannot afford these plans. No matter how cheap you make them, they cannot afford it. And the penalty for the first year for the individual mandate is only $95. For some people, that's beer money. Now, the next example is a similar situation. Another employer, Sam's hire date is 5/10/2014. But the difference is this employer decides to do a 12-month measurement period, and instead of starting on their hire date, it's the beginning of the month after the hire date. So what this shows is there's a small administrative period at the beginning. There is the 12-month measurement period and a very small administrative period at the end from 6/1 to 6/30, but the initial stability period starts at the same time at 7/1/2015. The reason why I suggest that, especially as a company, if you have a lot of turnover, instead of having 365 initial measurement periods, it cuts it down to 12. Again, new rules for if anybody goes on unpaid leaves, you have a choice. First of all, absence of 13 or more weeks. If somebody is gone for 13 weeks, comes back, when they come back, they're treated as a new employee, not an ongoing employee. And for educational employees, as much as 26 weeks. Or you can pick the rule of parity, which says if somebody works for you for a period of time, their absence is 4 weeks or more, and their absence is longer than what they work for you, when they come back, what that says, they're treated as a new employee, and accounting starts all over again. So if you have employees work 2 or 3 months for you, leave and come back, they may never be eligible for coverage because they keep on their initial measurement period keeps on reconfiguring. Somebody goes on unpaid leave, what this says, they release 2 methods. If somebody goes on family medical leave or they go on military leave, the employer may choose 1 or 2 methods, and counting how many hours they either can exclude the period they're gone, shorten it, or credit hours while they're gone at the same rate they were working before they left. If you haven't started counting yet, what the IRS has said is that we're going to give you a special deal for 2014. What you can do is instead of, generally the measurement period and the stability periods have to be the same length. They created a special rule for 2014 that said what you can do, you can use a 6-month measurement period with a 12-month stability period and then move to a 12-month measurement period the next year. So they created a special deal for 2015. They don't have to match up. So for 2015, you can use a shorter measurement period because you haven't started counting yet, and then go to a longer measurement period for 2015 and 16. Now, penalty taxes, as I indicated before, you are penalized as an employer if you don't offer coverage to full-time employees. This penalty applies separately to each member of a control group. If you're a company with 4 different members, 4 different corporations in your control group, what this slide is trying to say, and 2 decide to offer coverage, 2 do not, Only the two that don't offer coverage will be penalized, not the entire control group. That's what this slide says. Now, for 2015, the penalty is $2,000 per employee minus the first 80. Now that 80 is for the entire control group. So if you don't offer coverage and you have 100 employees, it would be 100 minus 80 times $2,000 or slightly higher figure. So what this slide is trying to say is the fact that it is done on a control group basis. In order to avoid the penalty in 2015, what this slide is trying to say is that you have to offer coverage to at least 70% of your employees. Now, you do have to offer coverage to dependent children. Again, it's up to age 26. And for this purpose, a spouse is not considered to be a dependent. So you have no obligation to offer any coverage to the spouse. In this situation, if you do offer coverage, you have to offer coverage that's minimum value and it's affordable. Now, you're going to be subject to the penalty, but it's only for those individuals that that only receive a credit and subsidy. At no time will you get, if everybody goes on the exchange, at no time will you pay more than the $2,000 penalty minus the first 80. In order to avoid the $3,000 penalty, you have to meet both of these tests. First of all, minimum value, the plan's share of total allowed costs at least 60%, which means that for any expense that the employee incurs, the plan will pay at least 60% of that. Most employer coverages right now are in the range of 70 to 80%, so this plan is pretty cheap. Secondly, the affordability test. The affordability test says 9.5% of the employee's household income. There's no way, as an employer, you know what the household income is. So what the IRS has done, they created 3 safe harbors. And you can base the 9.5% on one of these safe harbors. First of all, it can be based on box 1 of the current W-2, the rate of pay, which is $10 an hour, for example, times 130 hours. Or thirdly, the federal poverty line safe harbor, which is, I think, approximately 16.5 to 16.2. That means that every employee could pay a different rate. Somebody that is making $40,000 is going to pay more than somebody making $20,000. So you can vary it according to what the employee's income is, but it cannot exceed 9.5% of those figures. So it can vary. So what that means is the individuals that are making more money are going to pay more of the premium. And that is reverse discrimination, and the IRS said no problem. Now the question is, there's no limit on the deductible, there's a limit on the out-of-pocket. The out-of-pocket is at $6,350. If you are deemed to be subject to the employer mandate payment, the IRS will then notify you of that fact that you're going to be subject to the penalty. If it's determined the employer is liable for the penalty payment after the employer has responded to the initial IRS, the IRS will then bill you and then tell you exactly how much you have to pay. Also, starting in 2014, you have to report your insurance coverage. Reporting is going to be for periods after January 1st, 2015. The first returns are going to be due to 2016. This applies to any employer 50 or more. So any employer 50 or more will have to will have to file this with the Internal Revenue Service. This is all the information that you have to report. These forms are out. They are the forms are 1094C and 1095C. The question is, what does it apply to? It only applies. There are 2 forms. There is a reporting requirement under 6055 and under 6056. Under 6056, it's 50 or more full-time and full-time equivalent employees. If you're self-insured and under 50, you have to do a similar statement. Now let's look at small employers, the insurance mandate. If your plan is non-grandfathered, every plan will be community rated. And this is the only factors they plan is non-grandfathered, these are the only factors they will use to determine your premium. This is called community rating. Also, plans have to be, if they're non-grandfathered, have to be comprehensive health coverage, and must include essential health benefits. So, again, in the small plan market, under 50, plans must provide essential coverage, limit cost sharing, or provide either bronze, silver, gold, or platinum levels, which is 60, 70, 80, or 90% of actuarial value. This is the definition of essential health benefits. So every individual in a small plan must cover these factors. They must cover maternity and newborn care. They must include pediatric services, including oral and vision. This definition only applies to individual and small plans that are non-grandfathered. So every plan has to include this. Cost sharing. Again, there's cost sharing. Cost sharing includes deductibles, co-insurance, and co-payments. And again, I've given you that limit before. That applies to all plans. Now, here, for fully insured plans, here are all the requirements that apply to fully insured plans. There must be guaranteed availability, guaranteed renewability, process of review and disclosure, fair insurance premium requirements. This is only for individual small plan market. Comprehensive health coverage, medical loss ratio requirements, the new non-discrimination rules. These rules are not effective yet. They have not been released yet. It won't be until 2016 or 17 before they're available. And then the annual insurance fee. For self-insured plans, these are the only factors that apply to self-insured plans. Dependent coverage up to age 26, coverage for preventive service or cost sharing, non-rescissions of coverage, no lifetime limits on essential benefits, improved internal plans. As you can see, the list is much shorter than for insured plans. That's my contact information. If you want a copy of these slides, let me know. Thank you very much. Basically, the 9.5% rule says that at no time can the employee pay more than 9.5% of their wages. It can be based on W-2. It can be based on the rate of pay times 130 hours. That's what most employers are doing. So that's only for single coverage. You as an employer don't have to pay for dependent coverage. For the large employer calculation.
Yes.
Right. Anybody who works more than it's only considered to be one full-time employee.
Okay. So even if you have a lot of people and they add up to a critical number of hours.
For that calculation, that's all that matters. Thank you very much.
Good morning. My name is Katie Bragansky. I am the district manager of Amtrak in Schaumburg, Illinois. Hope you guys have all enjoyed the seminar so far. I want to say a couple of thank yous, and I'm going to take you through a couple of things that Amtrak has been doing for their clients to help keep them compliant with all these employer mandates. I'm sure your head is spinning, so I'll keep this one really easy. Thank you, definitely, to Larry Grudzien for your time today. I do know that he's going to open up to questions a little bit later on, and Tom Reed is here as well. I'll be opening the floor up in a minute with him as well. Also, thank you to JC Restoration for hosting the seminar here at their beautiful location. So Amtrak has been taking this employer mandate very seriously since its inception, and we've been providing our clients tools to help them stay compliant. Among the tools, you'll see an example of a report right behind me. The great thing about these reports is that it gives our clients the ability to understand things that Larry spoke about today, like determining your full-time equivalent employees over a measurement period, as well as being able to determine the affordability of the plan that you guys currently might be on. You can see that up on top, between 7 and 10, right in the middle. You guys can't see that? That's okay. Just know we do have these reports and tools for our clients, and we're also rolling out additional tools for our clients. As you know and as you heard, and your head's still spinning right now, there are a lot of changes going on with the ACA, and we're allowing our clients, or keeping our clients compliant with tons of additional tools coming up. So you'll see in your folder, this is actually in there. Take a look at it. If there's anything that you think you have questions about or anything that applies to you, please feel free to ask us afterwards. Amcheck is your local payroll company, and we're here to help you guys keep this all in order and stay compliant.